I'm Dr. Sandesh Mayekar. I'm BDS, MDS and MS recently I did from Tufts University, Boston. Well, if I just mentioned, one of the basic problem people face is that they feel that teeth are a little yellow. Now, teeth could be yellow due to various reasons. One could be due to age, that what we call natural changes. One could be astringent stains on the teeth. In India, you know, smoking, pan masalas and all those stuff can give the stains. So for them, we just clean the teeth and we do something procedure called tooth whitening called bleaching. Now bleaching is just a hydrogen peroxide which comes in different percentage, and depending on case to case we do tooth bleaching or tooth whitening by bleaching, wherein one should always remember that enamel is not affected by bleaching. But bleaching also stays for 1.5 years, unlike like what we put a Botox or fillers, what do people do? They also stay for 6 months to 9 months. Similarly, bleaching stays. But we give them a maintenance dose. We give them a maintenance dose so that they maintain it at home so it stays little longer. So bleaching is non-invasive, is on the superficial surface where the teeth become little whiter. Sometimes people have got a discolored teeth which are very dark in color, maybe due to some medicine or maybe root canal teeth. They become very dark, which is like bluish gray or black in color, similar to that, or dark brown in color. For this we do a procedure called laminate or veneers. Laminate veneer is one of the same term, but I have defined in international book is laminate where there is no change of color but change of shape, size, whereas veneer is change of color with maybe with shape, size. So when there is a discolored tooth and we want to mask the tooth color, we do a veneer. It's like a false nail. You know, as you put a false nail on the top of your nail, similarly we put a small coating on the top of the tooth or teeth which have to be, and then we match according to the smile line and smile procedure. So that's what is called veneers, which are the very less invasive procedures. Sometimes you got a gap in the teeth or crowding of the teeth, overlapping teeth. We suggest to go in for braces treatment. That is, we put a braces wires and we make them the teeth straight. And it could be combination, because sometimes the size of the teeth and the size of the jaw doesn't match. The jaw is normal size, teeth are small, or jaw is big, teeth are normal size. So we see gaps in the teeth which can't be corrected by braces. So we have to do combination treatment by braces and veneers. So when we plan the treatment, we basically first ask the patient what's their desire, what they feel their problem is, because it's always give them a complex if they know there is some problem in their teeth. So first we solve that problem, and subsequently we suggest them and we do a mock-up. We take a photograph before and then we do a mock-up in the mouth, show them how they might be looking, not exactly. We do a mock-up on the plaster model also, where we can show them how the teeth are going to be shaped before we put the laminate veneer. And there is something called digital smile designing, which we used to do maybe 15-20 years back, but we don't do now because we really can't give you exactly what the computer can give. So there is always a discrepancy, and patient usually say, well, I didn't get what you showed me. So we show them and then approximately, and then we design the smile. In this full procedure, it's not only me and my staff is involved, but we require a good dental technologist, a dental technician who makes those laminate veneers and cap. So that part is also very important for us, because they ultimately give the aesthetics which I tell them, or which we tell them the way we want it to. So this is the way we treat and plan the whole treatment. We of course take the x-rays before we start, because we should know there is no other further problem inside the teeth and all. So this is the way we plan it.